In popular culture and media, dopamine is often portrayed as the main chemical of pleasure. But the current opinion in pharmacology is that dopamine instead is more responsible for motivation. In other words, dopamine signals the perceived motivational prominence of an outcome, and this in turn propels the organism's behavior toward or away from achieving that outcome. Dopamine protects intestinal mucosa. It modulates our immune system. So what doesn't it do? How important is it? And what's the relationship between dopamine and health? Well, let's hear it. Several important diseases of the nervous system are associated with dysfunctions of the dopamine system. Parkinson's disease, a degenerative condition causing tremor and motor impairment, is caused by a loss of dopamine-secreting neurons. There is evidence that schizophrenia involves altered levels of dopamine activity. And actually, most antipsychotic drugs used to treat this are dopamine antagonists, which reduce dopamine activity. Similar dopamine antagonist drugs are also some of the most effective anti-nausea agents. Restless leg syndrome and attention deficit hyperactivity disorder, popularly known as ADHD. And this condition is associated with impaired cognitive control, and this leads to some problems with regulating attention, inhibiting behaviors, and forgetting things or missing details, among other problems. Dopaminergic stimulants, while addictive in high doses, they are incredibly effective when used at lower doses to treat ADHD. So what exactly are dopamine functions? Well, inside the brain, dopamine plays a very important role in executive functions, motor control, motivation, arousal, reinforcement, and reward, as well as lower level functions, including lactation, sexual gratification, and nausea. Many of my clients ask if there is a relationship between the dopamine levels and age, and yes, a number of studies have reported an age-related decline in dopamine synthesis and dopamine receptor density in the brain. The reduction of dopamine with aging is thought to be responsible for many neurological symptoms that increase in frequency with age, such as decreased arm swing and increased rigidity. Changes in dopamine levels, they may also cause age-related changes in cognitive flexibility. Parkinson's disease is an age-related disorder characterized by movement disorders such as stiffness of the body, slowing of movement, and the trembling of limbs when they are not in use. And in advanced stages, it progresses to dementia and eventually death. So as you can see, the relationship between age and age-related illnesses and dopamine is huge. But dopamine is also a very important element of pain. It plays a role in pain processing on multiple levels of the central nervous system. So decreased levels of dopamine have been associated with painful symptoms that frequently occur in the mentioned Parkinson's disease. Abnormalities in dopaminergic neurotransmission also occur in several painful clinical conditions like burning mouth syndrome, fibromyalgia, and restless leg syndrome. So having all that in mind, it's really important to keep your dopamine levels just right. And psychology, it has a couple of ideas how you can do it yourself. Interested? If so, please make sure to subscribe to my channel if you haven't done it yet. And if you want to see a recording that I make for you, a video on how to keep your dopamine levels right, let me know by liking this video and leaving a comment. And I'll speak to you next time. Keep your dopamine levels right.